Okay. I'm Charlene Harrington, president of the UCSF Faculty Alumni Faculty Emeriti Association. And I want to welcome everyone today, all our emeriti faculty and our retirees, to our presentation and to wish you a happy 2023. We're very pleased to have Dr. Jen Hastings to speak to us today on considerations and practices for gender-affirming care. She is an assistant clinical professor in the UCSF Department of Family and Community Medicine and a member of the Medical Advisory Board for the UCSF Center of Excellence for Transgender Health. She founded the Transgender Health Care Program for Planned Parenthood at Mar Monte in Santa Cruz, California. She served as the program's director from 2003 to 2018, and she supported the initial development of the National Protocol and Guidelines for Planned Parenthood Federation of America. She's very involved in research and education and advocacy on reproductive needs and experiences for transgender and gender expansive people at the national level. So it's a pleasure to have you, Dr. Hastings.
Thank you so much. Let's see, am I unmuted? Yes. And I am just taking this opportunity to change my name here because my pronouns are not she, and they're just Jen. And I am a non-binary genderqueer person. Didn't have that awareness as a 5-year-old or a 10-year-old or even a 30 or a 40-year-old. I was in my 50s, I think. Thank you for that kind introduction. And I'm going to share my screen now and get us going here. So we have a lot to discuss today. I can no longer see all of you, but I have asked Luis, and Charlene is welcome as well, to monitor the chat. If something comes up during the course of this conversation that just makes it so that you can't think or absorb anything that I'm saying because of your question, please do put that in the chat. I don't know if you can unmute, but I'm also fine with you unmuting and just saying your question. But I'm asking Luis and Charlene to kind of monitor the chat. This is way too much to put into 1 hour, so I'll do my best, and I have cut quite a few slides in order to accommodate some of the questions. And I just wanted to thank the two people, and I'm going to get these from my phone, who asked some questions. One of them was by a parent or an attendee who has a youngest child who is non-binary and is kind of wondering how to navigate that. And I can reference some things during my talk. I will certainly be including non-binary genderqueer, and often that goes under the umbrella of gender expansive, but also under the umbrella of trans. And then a question about school accommodation, which and bathrooms, which really varies, community by community, state by state, but we'll hopefully touch on these things. So thank you for joining, and let's go. So just a land acknowledgement for a moment, and also to take a breath here. You've all come probably from busy days, and what I'm going to cover hits some core understandings and issues. Let's see if I can take this away there. So yeah, hopefully a moment to just bring open mind, open heart to this material. And I'm on the unceded territory of the Awaswa-speaking Yupi tribe, who today come together as the Amamutsen. I don't know where you all are, but each of you probably is on land that historically was lived on and cared for by our traditional communities. And may we all work better together to take care of our land. Okay, and I have no disclosures, and everything here is off-label, but using national and international guidelines. So this is what I hope to cover today: some basics of gender, look at health disparities and barrier to cares, a little bit on gender-affirming environments and systems in healthcare, but really this extends into all kinds of systems. So wherever you come from, there are ways, or wherever you're working or living, there are ways to integrate and acknowledge and respect trans and gender expansive people. I'll talk just a touch on healthcare, and I offer to Luis and Charlene that if in the future this group wants greater exploration in any of these areas, I can either return or offer speakers in each of these areas, and then we'll touch on resources. So I just want to offer a moment for each of you to take a minute to think about yourselves. When did you learn, when did sort of the concept of gender arrive? There's concepts of gender development that by age 3, we kind of know what gender is and know what it is. Historically, that concept has been of a fixed gender, but we're learning more and more that gender can evolve and change over time. And I shared briefly my own journey, which is that I was that, growing up in the 50s and 60s, a typical what was called tomboy at the time. And probably if what is available now was available in 1957 or so, I would probably have a very different path. But I think it's helpful for us to bring our own awareness of gender and our own conception or idea of what gender is and what influences our gender just to this moment. So it might help you have empathy, compassion, and greater understanding. That's my hope, at least. So now we're going to dive into kind of current understandings or current paradigms of gender, which have really changed over the last 20, 25 years. So there's gender, we're getting as an awareness that it's more complex than we might have thought. So there's this internal or bodily knowledge, our own self-awareness of our sense of gender. And I love the term interoception, which is that internal sensing or internal knowing. Then there's your body, or what we have called historically sex, which is our chromosomes, our genitals, the hormones circulating through it, as puberty arises, that leads to secondary sex characteristics that kind of mark us, at least in our society, to be in one box or the other, the male box or the female box. And what has really changed is a deeper awareness of the in-betweenness of those boxes. And that actually is not a new concept by any means, and I'll explore that later with you all. So then there's how you look, how you express it, and then how you're perceived. So this last concept is really a double arrow. So we have gender roles, we wear clothing, and we are seen by people as a certain gender, and then we have a way of expressing what that gender is. And social expectations play a big role in this part of gender. So what happens as, trans and gender expansive people have this experience that how we sense ourselves is more complex than the words and expectations that have been assigned to us. And you may see sex assigned at birth or sex designated at birth as an acronym, which we'll talk about in a moment. So trans and gender expansive awareness is when our sense of self or body don't align with the gender expectations associated with our sex assigned at birth. And so this, female woman is something that begins to change. And so if we don't align, then we have actually many different ways of experiencing our gender awareness. And we may find identities or descriptions that align more closely with our own experience. And so that's a kind of a way of explaining what transgender or gender expansive awareness is. Cisgender is when your gender identity or expression do align with the gender attributions associated with your sex assigned at birth. So I'm just going to summarize that again, because that's a lot of different concepts all at once in a fast fashion. So there's our body, which we had talked about as also often described as sex, our chromosomes, etc. There's our gender identity, which is how we know ourselves inside. It's really an internal experience. So you really don't know my gender identity or someone else's gender identity unless I share it with you or you ask and I share it with you. And then there's how we express our gender, and it's how we are perceived. So those are sort of four concepts of gender. And you may have seen the gender unicorn, which replaced the gingerbread person. And this is created by the Trans Student Educational Resources Group. And where we again see some of those same ideas: gender identity, gender expression, our sex assigned at birth, and then these two other components that I haven't mentioned yet, which is around our sexuality, who we are physically attracted to, who we're emotionally attracted to, and just noting that those are two separate components: physically, who we are actually physically attracted to, and then who we actually sleep with might be different than who we're emotionally attracted to. But very important to note that gender and sexuality are different. And we'll review that again in a moment. So some more kind of basics around language. We have the gender binary, which I referenced already. That's sort of the boy box and the girl box, historically, two discrete and opposite categories. And just note that both cisgender and transgender people can have a gender identity that is binary. Some people, though, don't fit into that gender binary. And so we've come to discuss or talk about the term, the gender spectrum. And there's a great organization, the person who raised the question about having a non-binary child. The Gender Spectrum Group is a beautiful organization to get support from. Cisgender, we already talked about, and I just wanted to note that we have the Latin prefix meaning on the near side or same side of, and then transgender, where the Latin prefix means on the other side or the opposite side. So let's talk a little bit more about different trans experiences. So there's the trans masculine terminology, which has really replaced a term that was in the past, which was F to M or female to male. That terminology has largely been is no longer used by the trans community, but you may see this. You may see the acronym assigned female at birth, or AFAB, or DFAB, designated female at birth. So this is a person who can have a binary or non-binary male or masculine identity. And what about this person's pronouns? So they could be any pronoun. He, they might use she, they probably use something like he or they. And then a trans woman or a trans feminine person, probably assigned male at birth or AMAB, and also can have a binary or non-binary female or feminine identity. Non-binary, as I've already discussed, is someone who's not exclusively masculine or feminine, may identify or have the experience of both masculine or feminine or neither. You may see abinary, that's another terminology I think that I haven't put here. Gender fluid, someone who has a gender identity that changes. Gender queer has become a very common terminology, again, for someone who doesn't connect with any of the traditional gender kind of boxes or labels. It can be a gender identity or kind of a catch-all or umbrella term. Okay, I do have agender, not really landing in any gender terminology and seeing that themselves as not really being in a gender. There are so many and always growing terms for gender identities. And so the point is not to memorize what which one of these terminologies is, but to ask and to look up and to read and to explore. I share this graphic from the Trevor Project. They're a great resource. They focus on youth. And here you can see some of on the right-hand side there, all the different terminologies. And this is only a small number of them. I think also Facebook at one point collected a huge number of terms, something like 120. And of course, different cultures may have different terms. But in this study from 2019, the National Survey on LGBT LGBTQ youth mental health. They had 68% of the youth identifying as a male or female or boy or girl, and then the rest having different kinds of gender terms for themselves. And many people are comfortable with multiple terminologies or multiple identities. This is a graphic from Canada, which is kind of fun, looking at the gender galaxy. And there you have male, female, intersex, the assigned sex, and then here lots of other galaxies for the gender identity, third gender, cisgender, gender fluid, just another graphic or a way of exploring these concepts. This is their sexuality galaxy with lots of other terminologies for sexuality, which brings me to something I referenced earlier, which is this overlap or connection between transgender and terminologies for sexuality. So you're probably all familiar with LGBTQ. You might see it as LGBTQIA. You might see it as LGBTQIAA2SPP+. And so what do those all mean? All right, we have lesbian, gay, bisexual, transgender, and queer, which are probably all terms that you're familiar with. Queer is a great term because it, and a confusing term perhaps, because it refers to both sexuality. So if I say I'm queer, that could reference my gender or my sexuality. And here are sort of the defining the rest of those letters in the longer acronym. So we have queer, questioning, intersex, asexual, agender, two-spirit, which is the 2S, and then the pansexual, which is a term that refers to someone who is attracted to or sexually active with kind of all genders, and does not, their sexuality doesn't reference a particular gender. Pansexual is becoming an increasingly common identity for trans people because it does not reference the gender of either the person who is talking about themselves and their sexuality or the person they're attracted to. So if we think about a lesbian person, if I'm a trans woman and I'm attracted to other women, I may or may not identify as or call my sexuality that I'm a lesbian. And so then in speaking as a medical provider, the assumption is, for example, that if I am a cis person who's lesbian and I'm sexually active with another lesbian, another woman rather, and so I'm in a lesbian relationship, the traditional assumption has been that lesbian people have very little risk of unintended pregnancy. That is false for several reasons. One, because actually cis lesbian people may be sexually active with people with penises, even if they are identifying as a lesbian, and whether that be a cis man with a penis or a trans woman with a penis. So if I got you very confused there, I apologize. We will dip into that again. And if this is a good point to ask a question, please do that. And then I'll decide if it's the right time to answer it. But just to say, again, gender and sexuality are different kind of concepts. Gender is how I identify in terms of male, female, or other genders. And sexuality is whom I'm attracted to and whom I'm sexually active with. They do intersect, kind of like a railroad lines, crossing at some point. But they are distinct, different, but very connected. And I wanted to share this map. This is from PBS, just to point out the concept that this is not just a sort of newfangled concept that is non-binary. So many countries around the world, many cultures around the world have honored and lifted up non-binary two-spirit identities. So this is just an example. And I'm happy to share these slides. If you go to this website, you can kind of hover over the little marks and learn more about the two-spirit or gender queer cultures or communities there. Here's one in the United States, the Navajo and Dilba, who have traditional third gender. So some people often say, like, oh my gosh, these youth these days, they're just going off on some newfangled thing. It is not newfangled. It's actually centuries old, since the beginning of time. So let's look a bit at numbers. This is actually not so much numbers, but more percentages in terms of what is the prevalence of trans and non-binary people. On the left, we have the Pew Research Center looking at all adults, and I believe that's from May 2022, where 0.6 of all adults were identifying as trans, male or female, and 1% identifying as non-binary. To note that as we go in the younger ages, 18 to 29, that's a much higher percentage, which is really sort of the take-home point that I want to make, which is that our younger generation is a much higher percent of trans and non-binary folks, and it makes sense. This is, finally accessible. As a provider, I saw so many, 40, 50, 60, 70-year-old people coming and saying, I want to be myself finally. On the right-hand side, we have another kind of important concept. This is from 2015 from the US Transgender Survey. Finally, we're doing 2022. We now have the data for this same survey. But in 2015, about a third of people identified as transmasculine, or a third as trans feminine or trans women, and over a third as non-binary. So I think that's a great concept to put in our head or your head. I'm very interested in the 2022 data. With regards to youth, this is kind of referencing my earlier comment, but this is looking at below 18. These are two studies that came from two different places, showing about a 9.2% and a 7.2% of youth in the high schools that they were looking at who identified as gender diverse. So where does this awareness come from? So let's just dive into this a tad. Like, if there's a mismatch between what others see and how you feel, something called dysphoria, which has been actually a foundational concept in trans care and actually required traditionally for the diagnosis of trans, that would then allow you to access care in the US or whatever your system is, and that is discomfort or distress or depression related to your gender. But there's also these concepts, so in a more positive way, which is alignment, and euphoria, which is feeling what's good about your gender, or moving into a different gender and going, finally, I feel at home. And gender euphoria is finally being acknowledged. We have something called the World Professional Association of Transgender Health, which is kind of our organization where protocols come from or are created and written collaboratively internationally. It's a huge process, challenging, not without differences of opinion, but euphoria has finally kind of entered into the diagnosis and the process of determining or supporting someone in their understanding. And I'll talk more about that as we move forward. Knowing ourselves, developing self-trust, and this is really more of a slide referencing what caregivers and providers can do, which is that very important piece of mirroring someone's exploration. Without those, trauma and dysphoria result. And I would say, 100% of the people that I've worked with over the years, oh dear, I thought I had put myself on sleep there for my messages, apologies. So trauma and dysphoria are hallmarks for most trans people who have most times not been reflected or mirrored and experienced profound discrimination as they journey through life. This slide is not quite in the exact correct spot, but I wanted to share, this is also from that 2015 US Transgender Survey. And on the left-hand side, you have kind of the age of awareness in the people surveyed. It was 38,000 people in 2014 is when the data was collected. But you see that 32% remembered having an awareness under 5 that they were trans, by 28%, sometimes between 6 to 10, 21% between 11 and 15, and 13% between the ages of 16 to 20. So typically at a young age is when people come to an awareness that their gender is different than what they were assigned at birth, and then when they begin to share. So this is a really important point, that even though 81% of people knew by age 15 that they were had a different gender identity, only 15% had shared their gender identity by that time, and 44% came out after age 21. So that's really an important concept when you're a parent or a teacher or someone as we work with youth. And I just want to make sure that this kind of lands. This is work from Caitlin Ryan at San Francisco State, I believe. And her concept is that really looking at the vital importance of family acceptance, which is in and of itself a whole process. And the point of her work is that families don't have to do everything, but little pieces of acceptance. For example, sharing using the pronoun that a youth asks, or acknowledging in some way this kid's journey makes a difference and decreases dysphoria of the youth, and also decreases negative behaviors such as drug use and not going to school. So this kind of brings me to the barriers to care and the health disparities that trans and gender expansive people experience, and this concept that the lack of acceptance, stigma, discrimination, and trauma related to trans experience impacts one's physical and mental health. We've also seen this in the Adverse Childhood Events Study, which you're probably familiar with, or the ACEs, that this leads to physical health. And then this is perpetuated with the health disparities and inequities that trans people experience. So again, from the 2015 US Transgender Survey, looking both in California and nationally, pretty much, high numbers of people experienced negative things, having a lower household income, higher rate of HIV, experiencing bullying, homelessness, high rates of discrimination in their life, and challenges accessing healthcare. These numbers seem really low to me because as I've been a caregiver for many, many years, I'd say 100% of people had problems related to insurance and having negative experience overall in accessing healthcare. But this is the data that came out of that survey. And in my community, it's a higher percentage of people who basically don't seek help when they need it because of fear of being mistreated. Many of my patients would never go to an emergency room because of the fear of what would happen when they were discovered to be trans. Mental health disparities are very sobering, which a much higher rate of attempted suicide than are the cis heterosexual adults, high rates of sexual assault, partner violence, and other forms of trauma. For youth, we're turning again to the Trevor Project, where youth shared experiencing high rates of discrimination. Fewer than 1 in 3 trans and non-binary youth found their home to be affirming. And the conversion therapy, that's when a therapist tries to say, you're not really trans, you're really not. And you're probably familiar with that with lesbian, gay individuals. That is no longer legal in the state of California, but the Trevor Project is getting data from the US. So high rates of anxiety, depression, high rates of attempted suicide. And of course, this data is higher for those of color. And apologies, this is not the slide I wanted next, but that's okay. Important to note, this is a screenshot from today on the ACLU website. We have an increasing number of anti-trans and anti-LGBTQ bills in the United States. You're probably well aware of that. And even though not all these labs will become law, just the sort of process of them being discussed as potential legislation is extremely traumatizing. So this is the slide I wanted next, just to bring up the concept of intersectionality, which is that complex and cumulative way in which different forms of discrimination combine, overlap, and build upon each other to lead to greater discrimination and oppression. So that each of these concepts like gender, race, ability, class are overlap and mutually constitutive rather than isolated and distinct. And I think that's an important concept in whatever realm we're discussing it, not just for trans and LGBTQ community. So what do we do about it? Okay. So whether you're in a healthcare system or not, I think these concepts will be helpful to you. And if you are in a healthcare system or in another service industry, one of the important concepts is that all staff need training on this. The front person, reception person is probably the most important. So creating a safe space with inclusive language, visuals, posters, gender neutral bathrooms, very important. One of the questions that I got was related to bathroom safety. Incredible. I mean, a lot of kids and people hold their urine and their stool until they get home because they do not feel safe going into a restroom. I do trainings locally for Cabrillo College, and after my presentation, the youth basically started sharing their incredibly traumatic experiences in bathroom. People can be really cruel. If you're serving someone, a really key concept is introducing yourself with your pronouns, and I'll touch on that in a moment. Having forms that give a place for you to share what your current or affirmed name is with your pronouns that you use. There may be different legal legal aspects. So your insurance and your driver's license and your birth certificate may all have 3 different names and genders, so it can get complicated. What happens if you use a name or pronoun that's not accurate? What do you do? And I can't remember. Yeah, so if you use a name or a pronoun that is not accurate, hopefully you recognize it and apologize, but this actually is what we call a microaggression. And it, as a friend of mine said, it's not micro, it's just an aggression. And then in another talk that I gave, one of the people in attendance said, well, I'm not doing it on purpose. Why do we call this an aggression? And it's because of the experience. It hurts. So if I experience someone saying, and I get this all the time, it's so hard to switch pronouns, it really feels awful. It's like, oh, you're just an inconvenience. I highly recommend this website, Pronouns Matter. If you're kind of stumbling over this, hopefully what we do today will be helpful, but just Google Pronouns Matter, and they go into a very deep dive into why pronouns matter. So key concepts are to not make assumptions of someone's gender, both based on someone's look, their voice or their name. Don't make an assumption about someone's pronouns or what their anatomy is. And so if you're talking with someone, let's say on the phone, or you're meeting them and greeting them in a waiting room or whatever setting, it can be safe to use gender neutral language until you find out, either by asking or the person shares with you what their name and pronoun are. So not making assumptions creates greater safety. And so let's just do, can people unmute Luis and Charlene? Or if they can't, then you get to do it.
Oh, okay. I will help you out. Unfortunately,
Okay.
I cannot. unmute
Okay,
you.
then, so what would you say instead of saying, how may I help you, sir? What could you say that would not make an assumption about that person's gender?
How about, how may I help you?
Woohoo! Bravo. Okay, instead of saying this lady is asking about, what would you say?
This person?
You got it, 100%.
Okay.
Or this client, yeah. So I'm not going to make you go through the whole thing.
Okay,
But
thank
there
you.
you go, because in the interest of time. But there are ways. You just have to think about it. And one, for practice, you could like say, okay, today I'm going to only use gender neutral language, and you can get creative. It's actually possible. So now we're going to go into how you ask someone's pronoun, how you share your pronouns, and what if I make a mistake? I already referenced that. But just to say that sharing your own pronoun signals safety to another person. You're modeling for that other person. Look at all the pronouns there are. There are a lot besides he, she, and they. They is the most common non-binary pronoun. Here's how you conjugate. And here it is again, the reference to mypronouns.org, which is I really highly recommend, but also the NIH, the National Institutes of Health, created a draft guidance on pronouns in the workplace, put out last year, on the importance of gender pronouns and their use in workplace communication. So, she is speaking, I listened to her, the backpack is hers. That's kind of basic grammar, but if you're using they as a singular pronoun, historically it's been they in our lifetime, just to reassure you. Now the International Grammatical Society and Webster's have all come to agree that they can be a singular pronoun. So if I'm talking about one person, they are speaking, I listen to them, the backpack is theirs. So I think the next slide is practicing. So Luis, you're on the spot again. I'm talking about one person. I called Charlene yesterday. If Charlene has they as their pronoun, how would you say that? I called
Them.
Perfect. I called them yesterday. So that's using they as a singular pronoun. How about this? That is blank, not mine.
Theirs.
Perfect. You got it. So it's not that hard, but we're going to make a mistake. We just are. And so if you, like, sometimes people don't notice, in which case it's hard to take accountability if you didn't realize it happened. But taking accountability is so powerful. And I will say, as a non-binary genderqueer person, I so appreciate it when my brother, who always forgets, says, I'm sorry, I forgot, and says, I'll try again for me. So calm yourself, practice humility, thinking about impact over intent. So you may not mean to hurt someone's feelings or put a dagger in their heart by using the wrong pronoun, but you have. So think about that, and then apologize, and then slow down. Behavior change is hard. We know that as healthcare providers, but slowing down really helps.
Jen, I do actually have a question. I mean,
Yeah.
your pronoun is a little bit more complicated than the
Yes.
ones that we went through. How would you,
just instead of she, using they for me is better than she,
okay.
but you would just say Jen. And as my friend, who's also a doctor, said, it's a lot of Jen. And it is. And I wish, I actually, like almost every week, I sort of do this soul search, like, can I get rid of the Jen? Because it's just, but that they, them, I think I'm just not in the right generation for they, them, for me. So I was going to, so let's do this, Luis, you and me. Introduce yourself with your name and pronoun, and then ask me, since I'm unmuted, to share my name and pronoun.
Hi, I'm Lewis. What is your name?
Wait, what's your pronoun?
Oh, what is your
name and pronoun?
Oh, hi, my name is Lewis, he, him. What is your name and pronoun?
Thanks, Lewis. And I realized I was pronouncing your name wrong. Apologies for that. My name is Jen, and I, yes, have a very more complicated pronoun than most. I just use my name, Jen. So, So Jen is giving a talk, and Jen is probably has too many slides, but Jen wants to share everything. So it's just not using she and replacing it just with my name. Thanks for that question. And hopefully I'll move through this phase, but it's a good teaching example, right? That,
I agree. Yes.
that pronouns change over time sometimes. All right, so now we're going to dive into a little bit more of the medical piece and what gender affirmation looks like. The key to the key to gender affirming care is that it is patient-centered. I wish all care should be patient-centered, but it's individualized. So hormones, surgeries, procedures, these are vital for those who want them, but not every trans person wants to be on hormones or wants to have surgeries. But it's vitally important for those who do want them. So we're moving, affirmation, gender affirmation or embodiment, or what historically has been called transition, and in many communities is still called transition, can include social affirmation, which is named, pronouns, clothing, all of that, isn't medical. And in fact, up to puberty, we don't do anything else but this social affirmation piece. There's medical care, which, as I said, wouldn't start before puberty starts, but hormone, puberty blockers, surgery, birth control, assisted reproductive technologies, if those are needed. Legal changes, which can involve changing your name on your documents, gender marker in your insurance or your birth certificate, social security card, etc. In the state of California, we're very lucky. Your driver's license or gender or your identity documents do not require a medical provider or any legal support. You can just, fill out the form that the DMV has. Birth certificate does require, because that's at this point still requires a letter from a medical provider, a physician. To change your birth certificate. Social Security requires that your birth certificate is changed, and then the Social Security folks need another letter. So it's a little complicated. Again, none of these steps are necessary if you're a non-binary or gender expansive person, but for many, this is life-saving. So gender-specific care can involve hormones, as I said, blockers, procedures, surgeries. There's also sexual and reproductive health care. Trans people want family. I'll talk a little bit more about that. Being on hormones does not preclude you from either getting pregnant or contributing to pregnancy. We need all the preventive health care that everyone else needs. And the key to good care is collaborative care, really with the patient in the center and all of us communicating with each other. And really, this is vitally important for all care, not just trans care. So very briefly, and again, as I said, I'm happy to take more time and talk just about hormones. We could spend a whole day, several days doing this, but basically medical support can align that internal experience with external presentation. Estrogen leads to softer skin, breast development. Estrogen itself can lower the circulating level of estrogen. Sometimes we use additional medications like things that lower testosterone level. Testosterone itself, for someone who has ovaries and has circulating estrogen, if one adds testosterone within 2 to 3 years, you would never know that that person was not assigned male at birth, because it is very effective at lowering voice, contributing to facial and body hair, and leading to a masculine appearance. Puberty blockers, which I'll talk about in a moment, pause or stop sexual characteristics that are related to hormones. What's interesting about trans care is that behavioral health providers really need to learn about this medical care in order to be supportive. So puberty blockers are gonadotropin releasing hormone analogs, and essentially they turn off the endogenous production of either estrogen or testosterone or progesterone. And we can do this either with an injection of leuprolide acetate And now we have kind of from 1 to 6 months, or an implant that is effective for 1 to 3 years. As I said before, we don't start this until puberty has just begun a bit, and you can also use it mid or post puberty in some cases. So the benefits of puberty blockers are extraordinary. Before I learned about puberty blockers, or they began to be used in about 2003 in Holland. And we learned about them in around 2008. I started using them. They're very extraordinary for youth. They basically pause the development of those secondary sex characteristics that would come with the endogenous hormone, and then prevent, if you continue on them, them developing ever. And then you add the desired hormone. They give time to explore. They improve self-esteem. We now have great studies, both from the US and Europe, showing that for trans youth. The downsides are that for non-binary people in particular, that you have to choose at some point. We don't have, the ability at this point to select and choose the secondary sex characteristics that are desired. So at some point, a non-binary genderqueer youth has to say, okay, my primary hormone will be estrogen or testosterone. They're expensive, not always covered by insurance. They can limit future fertility, although there's a lot happening in that realm as well. So I just put here a podcast by a mom about the process of figuring out if this was right for her child. Non-binary transition is kind of its own thing. I have an article here that I wrote, I guess it was September 2021. If you're interested, I can, in particular, send that to the person who asked the question. Yeah, so sexuality and family building is a whole other area. We don't want to make assumptions, and it's as providers often do kind of go, oh, well, you're this gender, so you must be sexually attracted to that gender. So really important as providers that we create safe space for people to share actually what's going on for them. We always want to talk about safer sex. And, when I first began providing this care in early 2000, it was actually in the guidelines that trans people would be rendered infertile by taking either testosterone or estrogen. And as an abortion provider, I was, providing abortion care for trans masculine people who didn't realize they could become pregnant. So things have really, really evolved both in our understanding and in being better at being providers. So I just want to walk through this briefly. So these are all queer couples able to reproduce. So here's a gay cis man. So this person has a penis and sperm. And here's a bisexual trans man who is assigned female at birth and has ovaries and a uterus. So these people can create their own family. I just want to say there are many ways to create family. So adoption, just so many creative ways now that I'm seeing my patients and my friends create family. But this is for those who want to use their own gametes. So here's two polysexual, so those are people that are involved with multiple individuals, non-binary individuals. So if they're non-binary, we don't really know unless they're willing to share with us. One of them might have, so this person might be the one with the penis bearing, and this one might be the uterus bearing person. And here's a lesbian couple. I kind of referenced the lesbian couple able to reproduce at the beginning of our talk together. So here's a lesbian trans woman. So she probably has a penis, and this pansexual cis woman probably has the uterus and the ovaries with the eggs. So there you go. So moving to surgeries, there's so much happening, so much in terms that, things have changed so much since I began providing this care. And in particular, the area of genital affirming surgeries, where we're now able to keep a phallus and create a vagina, keep the vagina and create a penis. So there's just lots happening. Given the time here, I'm going to not spend a lot of more time here, just to say that this is a process and a journey. Gender is a journey, and the affirmation process is also that journey. And really the piece that I've been part of working on in terms of training medical providers and working with the guidelines is really centering the care in the person, in the client, not in the provider. Historically, trans care has been based on guidelines that were written by non-trans people who really didn't understand what being trans was all about. So I think we're making some headway here in terms of centering our guidelines and our understanding in the people who are trans. I want to reference, I have many more slides on the family journey. I think I just did, yes, I just moved to this rather than the 10 or so slides that I have, just to say that there is more understanding in terms of family journey around it with having a trans child. The Trans Family Alliance is a great place to get resources. This is the work of Sean Giabetti and colleagues. And so this will be available, these slide sets, so you can look more in detail if you wish. But here are some, this slide is actually from my colleague who runs the Trans Family Group in Santa Cruz for supportive behaviors for families using appropriate pronouns. I think I mentioned that, and chosen name, unconditional love and positive regard, even if you aren't on the same page about your child's gender. Creating a safe home and school environment, so important, and allowing and supporting gender expression, which I think is harder for some families when there isn't acceptance. With regards to schools, I will in the resources refer you to Gender Spectrum to help. They're a great organization. And you know, it's complicated. There was a question about what's happening in schools. There are some states, as you know, that are outlawing youth being themselves in terms of their gender in schools, which is, you know, from my perspective, just criminal. So let's move to resources here. Given the high rate of suicide attempts and suicidality, national hotlines are very important. I referenced the Trevor Project earlier. They have a wonderful Trevor text, chat, and phone line for youth. There's also the National Suicide Prevention Lifeline and the Trans Lifeline. Here are some resources for families in English and Spanish. Here is Gender Spectrum for legal and school support. Wonderful people. The Trans Law Center is also great. They're based in San Francisco. They're very, very busy, but they have great resources online in terms of name and gender change and other issues. National Center for Lesbian Rights and CLR also has great support and advocacy. And then for farm workers, the California Rural Legal Assistance Group has support for trans folks. These are supports for medical care. I think in the introduction, we referenced the UCSF Center of Excellence for Trans Health. We've created primary care guidelines and part of also the Lyon Martin Health Consult line, where we also have guidelines and support. You can send in a question and we'll send back an answer. Our best effort at that anyway. The LGBT, actually this is now called the LGBTQ Health Education Network, based in the Fenway in Boston, and then our national guidelines, and then which are the World Professional Association for Transgender Health international guidelines, and then the Endocrine Society. I haven't spent a lot of time talking about Intersect, but here are resources. Here are some articles and books, and then conferences. So yes, and then for the families, here's more. This is a quote from my colleague Andrea Damon, who runs Trans Families California, about the importance of parental support and the power of parent-to-parent connections to increase family exceptions. Oh, I did that twice, I think. And I love these workbooks for youth to help support them on their journey and figure out what's going on. And that's it. So I'm going to stop share. I guess I can't see the audience. So if anyone wants to write down my email, there it is. And we have a few minutes for questions. Not a lot, but a little bit, which was my goal.